I'm an American and I've lived most of my life in the US, but I lived in Montreal for 6 years. And during that time we had universal health care coverage. So when we went to Children's Hospital in Montreal in Canada, the process went very smoothly. My son had to have some outpatient surgery. There was no money exchange, there's nothing because it's automatically through their system. We moved down here in 2014. The organization I work for now, I've been with for almost 3 years. And between what they pay and what I pay every year in premiums, it's about $14,000, $15,000. And when I go to the doctor for anything other than my preventative care visit, it still costs me $150. If there's a disaster, then I won't go into bankruptcy, but that's about it.
The function of insurance companies is not to provide quality health care to all people, to make as much money as they possibly can.
Last year, when I took my daughter for her preventative care visit, apparently there are guidelines about what's covered in a preventative care visit that I wasn't aware of. Then a few weeks later, I got a bill for $150 for this appointment. And so I called and said, hey, this was preventative care. And they said, the doctor's primary concern is to make sure that you're getting the best health care you can, which is great, except that one of my big concerns is, am I gonna go broke going to the doctor? It's less about health care and more about finances.
We can't afford to continue spending almost twice as much per capita on healthcare as any other country on earth. We can't afford to have 30 million Americans having no health insurance, and even more be underinsured with high deductibles and high copayments. And maybe most importantly, in our great country, we cannot afford to continue being the only major country on earth not to guarantee healthcare as a right, not a privilege.